Hello and welcome to Health Professional Radio. I'm your host, Patrick Reyes. Now, type 2 diabetes is the fastest growing chronic condition in Australia. Actually stated by Diabetes Australia website, 280 Australians develop diabetes every day. That's one person every 5 minutes. Now, joining us today is Dr. Hani Al-Salami. He is an Australian and New Zealand registered pharmacist. He's conducting collaborative research in Australia and abroad, focusing on utilizing cell and drug microencapsulation and biomaterials for diabetes treatment. Welcome to the show, Dr. Hani.
Hello, Patrick.
All right, so can you tell the audience who you are and what it is you do?
Okay, so my name is Hani. I've done my undergrad degrees in pharmacy before going back and doing a doctorate, and I specialize in diabetes. I did that back in New Zealand before moving to Canada, Montreal, where I continued to work on diabetes treatment, and I've been in Australia for about 4 years or 5 years now, and continuing with the same path, which is looking at different ways to manage and optimize current diabetes treatment.
All right, and how close are we to replacing insulin injections with an insulin microcapsule for diabetics?
Well, the work I'm doing at the moment focus on creating a special design that can permanently, long-term replace insulin delivery. So at the moment, for example, insulin is used by all diabetic patients, all type 1, about 30% or more for type 2, and almost the majority of gestational diabetic female patients as well. So it is commonly used, and the way people use it is through injections mainly or a pump. So what I'm working on, I'm not the only one. This is an interest worldwide, is to design a special capsule that you can place not insulin, but the cells that produce insulin. Mm-hmm. So this device gets transplanted into the patient and can efficiently produce insulin long term, so they don't need to continue injecting insulin every day or every week.
Now, will these capsules help in people with either type of diabetes?
Correct. So at the moment, the insulin is being used by all types, different ratios. So what I mean by that is the type 1, all of them need insulin. If you have type 2, some with insulin. And if you have gestational diabetes, the majority will need insulin. So it's needed by everyone, but to different degrees.
Now, can you give our audience a general idea of just how many Australians have the type 2 diabetes?
So type 2 is the main type. So more than 90% of diabetic patients have type 2. And in Australia, if you talk about diabetes, you talk about type 2. So every 5 minutes, one become diabetic, as you said. And the ratio is going up and up. And I think Australia is ranked 5th in the world in the prevalence of diabetes. So it's very problematic for Australian economy. We spend about $9 to $10 billion a year fixing diabetes problems, and that makes it critical to find something which is a bit more effective than current treatments.
Now, what are the latest experiments and findings concerning new discoveries in drug and cell application in diabetes?
Well, that's a very good question. So there's a very wide range of different experiments and clinical trials being carried out to target diabetes. And the reason why there's a very large number of different novel deliveries and new deliveries is because the current ones are not doing the job properly. So, for example, you have more than half the diabetic patients who take their medications in time are still not controlling properly their blood glucose. So even when you take your medications and you're doing the right thing, you still will not be able to control your diabetes symptoms. And the reason is because the medications that we have are not as effective as we want it to be. They're better than nothing, of course, and some of them are really good, but they're not they're not as good as we want them to be to retain the healthy status as such. So current medication. So there's different types of approaches to current medications. There's some people that will deliver new drugs. So you can either encapsulate or you can deliver a new drug that will have more robust and more reproducible and consistent effect in controlling the disease. So they may have a drug that will stimulate more secretion of insulin, for example, in type 2. They may have another drug that will be more effective in synthesizing the cells to make them more sensitive to insulin, because in diabetes the cells may not become as sensitive to insulin as they should be, and that's why we inject more and more and more insulin. So some drugs try to counteract these problems. So mainly, generally speaking, you will have approaches where ranging from special drugs into special cells. My aim focus now is in cells.
And why could the outcomes of your research project be important?
Well, the alternative, the ultimate goal for my work is to produce something that will minimize hardship of current treatment and side effects, and also will have something that replace needed medication. So every single time you take some antidiabetic drugs long term, you end up with problems. So the uniqueness of my work is to reduce potential side effects and harm in the future moving forward, but designing something that can naturally replace what's been damaged. So what I mean by that is when you have diabetes, your body starts giving up on a lot of normal physiology that has been established and normally happens in the body, and it starts to be compromised in terms of how the body functions. So my approach is to retain that, optimize. That's the aim. I haven't get there yet. I think it will take many years to come up with something that is useful enough, in my opinion. But it's still got a long way to go. Mm-hmm. But I think it is getting there. And I don't work by myself. I work with other people as well in Australia and overseas.
Right. And as for our final question, and which is a favorite question among health professional radio, what would you say is the biggest misconception you've heard in regards to diabetes or diabetes treatment?
I think one of the biggest, probably it's not all wrong, but I think it may overstate, is the fact that it's all about lifestyle. And the simple answer is it's not. So, for example, obesity is only a risk factor. It's a 30% risk factor. So it's not. So you can have people who are slightly BMI of, I don't know, 30 or 29 or something like this, and they can still be healthy. So it's not all about what we do. It is partially, yes, but not it's all about our mistakes as such. Genes and environment do play a big role in diabetes, not just what we do.
Right. All right. Well, it's been a pleasure talking to you today, Hani.
Thank you so much for that. Appreciate it.
Now, you've been listening to Health Professional Radio. Again, I'm your host, Patrick Reyes, and we've been in conversation with Dr. Hani Al-Salami as we talked about the latest in diabetes research. If you've missed our conversation or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.